Welcome to Machine Minds, where technology and humanity meet. I'm your host, Greg Terrusian, founder of Samson Rose, a recruiting and search business focused on the robotics and AI industries. The Machine Minds show is where we dive deep into the intricate world of robotics and artificial intelligence. As a staffing industry leader with a passion for the frontiers of technology, I'm pleased to be bringing you intimate conversations with the founders, investors, and trailblazers who are at the heart of the AI and robotics revolution. In each episode, we dig into their journeys, the applications of the products they're working on, and the breakthroughs that are shaping our future. Join us as we explore how these machine minds are transforming the way we live, work, and understand our world. Whether you're an entrepreneur, a tech enthusiast, or just curious about this amazing field, you'll learn something new with each episode. Let's delve into the extraordinary. Let's delve into Machine Minds. Hello and welcome to Machine Minds. I'm your host, Greg Terrusian, founder of Samson Rose, your robotics talent search partner. And on today's episode, I'm joined by the co-founders of ATDev, Todd Roberts, CEO, and Owen Kent, CMO. Thanks for being on the show today, guys.
Yeah, great to be here, Greg. Thanks for having us.
Yeah, thank you. This is very exciting.
Yeah, my pleasure. I'm excited too. Let's jump into it. So we've obviously previously spoken, and I'm very familiar with this, but I'd love for you to share the story of how the two of you initially met and then realized that you had complementary skills to start a company.
Yeah, so we have a pretty funny story about how we met. I had recently graduated from Berkeley, and I was living in kind of a converted warehouse, like a live workspace. And as you know, rent in the Bay Area is just exorbitantly expensive. So I was looking for some non-conventional roommates. And so I ended up setting up some like shelving units, like industrial shelving units in the warehouse, and turned them into like sleep pods. And so Todd was one of the people that was crazy enough to want to live on a shelf. And came to find out that we had really a lot in common. And particularly in the design and engineering for assistive technology. So that was really exciting when we met and found out that we had that in common, but the coincidences didn't stop there. I was mentoring a course at UC Berkeley again, designing for the human body, where I was mentoring students on how to make design decisions in assistive technology, and Todd was actually in that class.
Wow.
And so we made the professor, who is one of our advisors now, Dr. Grace O'Connell, put us in the same group, and that's really where the initial idea for our flagship product, Reflex, was born.
Amazing. I did not know that you were in that class as well. That's cool.
It was like coincidence stacked on top of coincidence.
Yeah.
I mean, the first time we talked was actually on the phone right before I traveled out to Berkeley. And I was, I'm from Southern Maryland, so my parents had taken me out to a crab shack right before I left. I was sitting down eating a crab cake, and I got a call from Owen, who was one of the potential people I was going to live with in the Bay Area. And the first thing I told him was, "Hey, I'm eating a crab cake. What are you doing?" And he's like, "Oh, I love crab cakes. His grandmother's from Maryland," and so we immediately hit that off. And then when I walked into his apartment and saw this live workspace with this crazy living situation, my buddy that had driven me there, he said, "Well, I guess this one's off the list. Let's go to the next one." And Owen came out, and I said, "No, absolutely not. We got to see where this is going to go. I think Owen and I are going to hit it off." Because I had picked Berkeley because I wanted to get deeper into assistive technology. And so meeting Owen just randomly on Craigslist, of all places, right?
Wow.
That's not usually where you go for a long-term relationship, but this has turned into one of the best relationships in my life.
I love that. That is awesome. Remind me when we come offline to give you a recommendation for crab cakes in SoCal. I know we're not far. But
Okay,
we'll talk about that
please.
separately.
Yes, yeah, you can't put that on the air. You can't tell everybody.
Can't put that on the air unless we're getting advertising.
Yeah, they can't now.
Not for free.
So that's amazing. Okay, that's great. I did not know some of that story, so thanks for sharing. And what inspired you guys to actually start ATDev?
I can start,
Yeah, go
Todd,
ahead.
if that's all right.
Yeah.
So, that, like I said, so we were in that class together, and I had pitched an idea around a personal problem that I've had as someone that uses a wheelchair and not being able to get as much physical therapy as I would like. So, I had kind of the initial high concept of using robotics to do physical therapy on, for me, it was my arms. That's really, what I wanted to do. I have a neuromuscular condition that leads to a lot of atrophy of my muscles. And so, particularly in my arms, I wanted to be able to stretch out more. And Todd was studying exoskeleton design. And so that's kind of where we initially found our collaboration niche in using kind of the principles of exoskeletons to do physical therapy.
Yeah, it just kind of lined up. I mean, Owen was talking about how can we regularly move my arms back and forth, and basically an exoskeleton is a brace with a motor attached to it in different places, and so that kind of lined up right from the get-go. And then I graduated from Cal right into COVID, so 2020. May of 2020 was my graduation. We had gone in the fall. We had worked as part of Dr. O'Connell's class to come up with the initial concept, myself, Owen, and a great group of other engineers at Berkeley. And then in the spring, we had decided, hey, the group was working well together. We'd come up with some interesting research. And so Grace helped us run an independent study in the spring. We got a very small amount of money from the Jacobs Institute at Berkeley. It was a couple grand to go build some prototypes. And so we worked together with Owen. Lots of work done over dinner in the live workspace, trying out prototypes. And then when we graduated, Owen and I had initially planned to stay in Berkeley and set up this sort of studio space that was going to be a mix between assistive technology and a studio. I had not gone to Cal to be an entrepreneur, and I just wanted to do assistive technology and cool engineering, but we'd had so much fun building stuff together, and there's so many products out there that really weren't hitting the mark that we thought, how can we go in and build the things that we really want to build and benefit from the traction that we've already started to get with this device. And ultimately, the only conclusion was to try to start our own business. So in September of 2020, after sort of thinking about a couple different ideas over the summer, we decided to incorporate ATDev so that we could start applying for grants. We're like, okay, how are we going to get our first dollars in? And in order to raise non-dilutive capital, you've got to have a cage code, all this stuff that you can only get if you're a registered business. So that was kind of the catalyst for us to actually turn it into a business and start doing our research under an official name.
That's great. And the mission for ATDev, obviously, initially you had a very specific use case, and I know we'll go into like your products and everything like that, but have your goals or mission already changed over time from like initial concept or use case to where you're at today, even in the early days?
Yeah, so technically we're a benefit corporation, a B Corp, which is similar to a C Corp, but has an additional bottom line for shareholders and responsibility to community. So a lot of other B Corps are Patagonia and North Face, like REI, I think, is a B Corp, and they have the additional responsibility of being environmentally conscious. So for us, ours is really using technology to improve people's well-being.
Yeah. And I would say, that mission has broadly stayed the same the whole way through. there's cool tech out there. It can definitely make an impact in people's lives. How can we apply it? But as we have gone through different grants and had the opportunity to talk with more and more amazing advisors, we have sort of shifted the way that our product is oriented and focused as we go to market. We initially started trying to make a device for Owen and then tried to expand into the neuro space. But the first money into the business was the NSF I-Corps program. It's a $50,000 non-dilutive grant from the NSF to take ideas that are spinning out of a research university, or I think any university, and go out and talk to customers, right? Because you spend so much time just kind of in your own head thinking about what the product could look like, and they want you to, quote, get out of the building and go. They force you to talk to 100 customers over a span of 3 months. So that's all you do.
Wow.
That's a lot of work, right?
Yeah.
So we went out and interviewed a ton of people, and with our device, which was basically a single jointed brace with a motor attached to it, and we ultimately decided, the neurospace needs physical therapy through robotics, but the morphology of our device isn't quite servicing that need. We need to service the whole body, so it needs to be a more complicated, larger device. But there's another space, there's orthopedics, single jointed injuries like ACL, tears and recoveries, total joint replacements, that our type of technology, where it is today, can really make an impact. So didn't change the overall mission of trying to enable people to live better lives through technology, but just changed our initial patient population. And so after that first pivot, we've stuck with orthopedics for our growth to date. And then, but the long-term goal is to expand back into the neuro and other patient populations.
Yeah, I think also the market size was really a driver of it. The neuromuscular, space with a device like ours that can provide remote physical therapy is a lot smaller than the total knee replacement market size. So that was also a big learning that we took away from the NSF I-Corps program, is that no matter how cool your technology is, and even if it might help one person really, really well, in order for you to have a sustainable company, you have to have that product market fit.
Yep, absolutely.
Amazing. Yeah, that makes a lot of sense. I've heard it so many times repeated, and something that I really want to drive home to people, especially founders in the startup world, is that you need to speak to your customers. It's all great having a well-engineered, well-thought-through product that, like you said, Owen, can maybe help one person, help them really well. But if you're looking for a viable business and something that can scale and people are going to invest in, especially in the hardware world, right? It takes a lot of dollars, a lot of R&D, so you need it to be viable.
Yeah, one thing I've always heard people say is, a great team with a great product in a bad market isn't as good as a bad team with a bad product in a great market.
That's so true. Yeah, I haven't heard that.
We like to think that we're a great team with a great product in a great market.
Yes, exactly. Yeah, and I think the nuance there, right? Because I know you talk to robotics companies of all types, right? And we're sort of this hybrid of a robotics company and a medical device company, right? And so it's, when Owen talks about the market not being there on the neuro side, not that the number of patients isn't there who need these devices, but the medical device companies live and die by insurance reimbursement, right? Like your customer, you can make a direct pay medical device, but most of the time, if you want to have a really large total addressable market, it's got to be something that the big payers are paying for: Medicare, Medicaid, United, right? And they're just unfortunately not paying for long-term physical therapy in the neuro space right now. That's an educational process that we want to eventually show them the value of, and how we can achieve that through low-cost robotics. But insurance companies are paying out for orthopedic rehabilitation right now. So you really have to go find, there's the patients who are ultimately the end users of your product, but your customer most of the time is actually the insurance company. So it's kind of this interesting, you got to talk to the patients and the doctors to make sure that you're truly having a clinical benefit and helping them. But then you got to talk to the insurance company to make sure that they're going to pay for it, right? And unfortunately, insurance companies are keen on keeping their money, right? They're not as.
To put it lightly.
Yeah. They're trying to do the right thing, but
Yeah.
it's sometimes they operate a little bit more like a hedge fund than they do
Yeah.
like a public resource. So
Yeah, it's so, I mean, it's kind of frustrating from I'm obviously not in the position where I need a lot of like the technology that I speak to people about that they're creating or have their concepts, but even in stuff like assistive living, aged care, stuff like this, it's so frustrating that is the hurdle, right? Because the barrier to entry or the barrier for usage is the cost,
yeah,
and people needing it can't always afford. Like you look at age population or whatever, same sort of thing. Or if you need assistive technology or help in your home, it is through insurance or it is through some kind of grant. And if that's not willing to happen, then there's great tech, there's a great need, but you just can't bridge that gap. And that's so hard to hear sometimes.
yeah, and to give the insurance companies their credit, right? They have been sold some snake oil in the past, right? And
Mm.
they now, most of them have set up innovation groups which are very responsive, and like we've been talking with United's innovation group. Medicaid has a great innovation group. Medicare has a very large one. And you can go talk to them as an entrepreneur and say, hey, this is what I'm thinking about doing. What would it take for you guys to be interested? And the answer always boils down to, we want to see data, and then we want to run a pilot. But they'll work with you to tell you what that
Wow.
data needs to be and what that pilot structure would look like. The most difficult thing is that you're usually talking about long timelines, which is difficult to then go back to your investors and say, hey, we want to do a 3-year study with Medicaid, right?
Wow, they're that
That's not
long.
well, it's not all of them. You
Yeah.
can run shorter pilots and things, but you've got safety procedures on the front end, IRBs, and then you got to get the study spun up and recruitment. So they're trying to be very data driven, right? And as ideally we should be, but it can be frustrating for sure at times when you've got something that is working and is data backed, and then they want to create their own data set. So, but I think some people, sometimes I talk to other entrepreneurs who just don't even talk to the insurance companies, and they kind of get this rep of being this walled off thing. They are willing to talk. If you go talk to them, you might not like the answer, but they're willing to try to tell you what they're looking for, right? So we've learned, and again, that was kind of came out of the I-Corps process. We talked with patients, doctors, insurance companies, also the FDA, right? Talking with the regulatory bodies and having them, they want to give you advice. They want to make their lives easier, tell you what type of data they need to see so that you can move through the process. It's just usually then comes back to how much time and money do you need to hit their goals, and can you convince an investor that that's a worthwhile bet?
That's awesome.
I think. Oh, sorry. I was just gonna add. I think I mean definitely the like cost of medical devices is a really big problem that a lot of people struggle with. But I think that what's exciting for a startup like us is that we're in a position to help like redefine some of those traditional like payment structures, and look at other pricing models, like for example robotics as a service, using like a subscription model rather than a one cost or upfront payment. I think there's a lot of potential for startups in the healthcare space and robotics healthcare in particular to kind of reshape the narrative on how some of these traditionally unaffordable products are delivered to people to improve their lives.
That's really great. Well, I mean, that it's refreshing to hear that from both sides, because I wasn't aware of that, like the innovation groups and stuff like that. So that's really cool, and I hope that helps a lot of people that are going to listen to this and thinking of products or working in this similar space, developing something in that. And that's another great learning, trying to be flexible with the payment schedules and what that looks like, because sometimes it doesn't make sense to purchase it outright, if it's going to be temporary use or, occasional use or something.
Yep.
Yeah, and I think the other thing I would add is that, we are in the midst of a great aging, all across the world. The demographic pyramid is just getting more and more elderly. And I think that it's going to be up to, countries and companies to figure out how to really address the elderly care problem. I have been the executive director of a independent living center in the past, and one of the biggest problems that we face, and the state has kind of pressed us to find solutions for, is the caregiving problem, because they're just as people age, there aren't enough caregivers to provide support. And so I think that there's really a lot of room for innovation, and also there's a lot of money in the space too. As the baby boomers start realizing that they need more comprehensive medical treatment, there's incentives, and I think if people can align the incentives, there'll be a lot of potential for improvement and profit as well.
Oh, well, that is really great. And Owen, offline, I might want to talk to you about someone else who is building a startup for the aged population and assisted living there. So something I can give them, and probably get some advice from you for someone else. So thank you for sharing that, which is really great, because this is one of the reasons I love doing this podcast. I have so many interesting conversations every week anyway, but then I get to learn stuff from new industries and new ways of working, and inadvertently help people. So that's great.
Yeah, absolutely. I'd love to chat.
Yeah, perfect.
Well, I was just going to say, I think one of the real reasons that we've been able to get as far along as we have is just because so many people like yourself have been willing to take a 30-minute conversation and hear about what we're trying to do, give us some feedback, some critical feedback. You don't want to just get all positive things about what you're doing, and then connect us to somebody else who knows something, right? So many people who are willing to do 30-minute chat has allowed us to build out this understanding of how the market works, where we could best fit our product, and how we can grow. And that, I think, again, gets back to that first iCore experience of just talking with people. The more people you talk to, the more you learn, and then it really just helps the whole ecosystem grow. So we appreciate you putting together these conversations and putting them out there. It's a great resource that sometimes feels like it's behind a closed door.
I appreciate that. Well, going through that program sounds like, anytime you start a company and you're going on that entrepreneurial path, there's challenges that you face, especially in the early days, right? You either have to pivot, or you don't have your cost right, or things like that. But it sounds like you had a lot of early learnings as a result of that, which is awesome.
Yes.
So it sounds to me that you should probably advise people, or people should be advised to try and figure out either a program or something like that in their respective industries. Would you say?
Yeah, absolutely. And I mean, the iCore program is very broad, right? They'll do all industries. I think they do their acceptance criteria varies year to year. So, you just Google NSF-I-core. They'll tell you. A lot of times, I think it does have to be spinning out of a university. But it's nice because you've got $50K of non-dilutive funding to support you as you're going through that process. And I mean, the hardest thing for any startup out of the gate is money, right? Obviously, you need to have a good product, you need to have product market fit, all the other fundamentals. But we were straight out of university, so none of us were sitting on a nest egg or anything else. And so getting just finding those first scraps of capital to come in while we were doing the customer discovery and the early product development, that was probably the biggest struggle. And the other nice thing that the program provides is accountability. I think everybody would tell you that they know they should be talking to their customers, but you get caught up in emails and talking with investors and the immediate day-to-day. But the structure of the iCore program forces you to just throw everything else to the side and go talk to people. And so I think either forcing yourself to do that internally, or finding a program that gives you a little bit of structure to do that around is really key early on. But also not stopping. We're not talking to 100 customers every 3 months necessarily, but I'm constantly out traveling, meeting with doctors, showing them the latest version of technology, patients, so that we can iterate based on their feedback, and keeping them in the loop as much as possible is really key to building something that's actually useful.
Yeah, I think my biggest takeaway from that is just build something that people want. And the easiest way to figure out what people want is to talk to them and ask them what their biggest problems are and try to categorize those problems into, shark bite problems or mosquito bite problems. And, ideally you want to solve a shark bite problem.
Love these analogies. This is awesome. All right. So we talked about your flagship product and who you're helping as well. What was the process? I mean, you can reiterate it and talk about it in a bit more detail, depending how deep you want to go. But what was the process going from the initial ideation to creating this market-ready product, or to get you guys to the stage where you're at right now?
Yeah, lots of iteration, right? So like Owen said, it started in a class, Advanced Designing for the Human Body. And, the first thing our professor at that time walked us through a very structured ideation, prototype, test, and then come back and iterate, right? We've kept that going since. But I mean, we started initially with not even 3D printed parts, just, I think there was some cardboard, some toothpicks, like very quick mock-ups to just kind of understand what might fit on Owen's arm. And then from there, we started moving into, computer-aided design modeling and actually 3D printing models, and then starting to combine electronics and motors and everything into the brace. We've gone through 5 or 6 iterations at this point of the system. And each time we have a new iteration, then we go, like I said, we mentioned, we go out to doctors and patients, have them wear the system. Is it comfortable? Is it moving the right way? Is it collecting the data that you'd be interested in having it collect? And we've extended the grant process as well, right? So we went through the I-Core program. That gave us our initial sort of understanding of the market and what people wanted to see. But then we got a SBIR from NIDLR, which is a sub-agency of the NIH. And so that let us dive a little bit deeper on the technical side, spend some more money on R&D, build more robust prototypes, and get something that was that worked actually in front of doctors to test, got feedback. And then that traction allowed us to go into an accelerator program. So our first venture capital came through the Berkeley Skydeck program. As a Berkeley spin out, we had gotten connected to them, and we had been one of they called it a hot desk team at the time. So we were getting free advising resources and things, but we hadn't been funded. And then beginning of 22, we reapplied and got into their cohort. So they take 10 companies every couple of months, every 6 months, and give you roughly $200,000 to go out and really accelerate your business. So it's sort of a Y Combinator model, slightly different check size. But that let us take our early prototypes and really turn them into closer to an MVP, still not an MVP, but then go run another feasibility study and partner with some other doctors. And then we were able to take that traction, and we met another investment group actually based right here in Southern California, FP Solutions. It's a group of ex-Tesla and SpaceX engineers, manufacturing engineers. It's a really wonderful hardware-focused group, very specific to this space, very exciting, that specifically invests in hardware, deep tech, which, can be hard to find in this venture capital world. But not only do they provide capital, they also provide bolt-on engineering services. So it really felt like our team grew quickly at that time. They came in, wrote us a check, closed out our pre-seed round, and helped us build out devices for another study. Go understand, a little bit more about the device, iterated on the device, and then 23 we went out and sort of did a string of conferences and presentations, innovation summits, presenting to the most forward-thinking doctors we could find. In the medical device space, people talk about finding key opinion leaders, doctors who are out there writing papers, really kind of pushing the industry forward. And so we wanted to go talk to those key opinion leaders, get their feedback, and then people who really believed in the product, get them on our team, get them supporting us and helping us meet more of their colleagues and eventually potential customers. And then so by the end of 23, we'd done one more iteration on the system and had started raising another round of capital. And then now this year we are out meeting still with more doctors, showing them the product, and we'll be launching the product towards the second half of this year. We're going to be doing a limited market release across Southern California and the Mid-Atlantic of the United States. So it's been very iterative, and sort of each iteration has moved as we've pulled more capital into the business and gotten more feedback from doctors.
That's awesome. So you mentioned you didn't go to Berkeley to become an entrepreneur. And this is kind of something you fell into, it sounds like. So, and Owen, I'm not sure if that was always the path you wanted to go down. I know you mentioned being like a director in some facilities and stuff like that beforehand. But
yeah, well, I got my degree in film, which is why we build exoskeletons now.
Yeah, it makes sense. I see the connection. So you guys, both of you must have had some real key learnings from this journey so far. I mean, you've obviously shared a lot here, like building something that people want and speaking to customers a lot and all these iterations, etc. But are there any other things that have kind of struck you from becoming an entrepreneur and running a business and instead of being an employee, right, just working on a product from that side?
Well, for me, I think having a disability has kind of led me to be an entrepreneur, just in the sense that, I have a lot of firsthand problems that I want to solve, and I would like to, devote my life to that. So I think that's really what has led me to entrepreneurship.
Yeah.
Amazing.
Yeah, I think for me, I mean, when people ask just flat out, like, why did I start ATDev? And I think that the truest answer is because I met Owen. I met my co-founder, right? I think starting a business with somebody, as well as bringing an investor on your team, is really like a marriage, right? Don't tell my fiance this, but I spent more time with Owen and my team, right? Just day in and day out working on really hard problems. And I think entrepreneurship boils down to just, do you care enough about the problem that you're solving to keep solving the random problems that pop up, right? Like we're trying to build a medical device to do at-home physical therapy, but we might have to spend a week figuring out how to set up ourselves as a certain type of contractor with the US government and get a code number so that we can receive a grant in 6 months. It has nothing to do with building the medical device, right? But you just have to keep solving these infinite number of problems. And I think the only thing that keeps you going is, do you care enough about building the solution personally? And then also, do you just have amazing team members that are in the trenches with you, that you can be honest with and that you're fighting with, fighting side by side, sometimes with, but fighting side by side against all the challenges. And so I think, you just, everybody's team is really important, but I think really early on, having not only a really skilled team, but also a team that you trust and that you can talk to open and honestly with. I think that's been one of my biggest learnings about entrepreneurship, for sure.
That's right. I mean, that leads me on to what I wanted to ask you next about how critical is having a strong team to your success. And especially in the early days as well, right? Because it's probably small, lean, got to move quickly, different iterations, getting feedback from users, customers, things like that. That takes a certain type of person, team, engineer, and perspective,
Yep. Yeah, 100%. I mean, we were in, and for the first year, we were all sort of part-time. We didn't have any space. We were pulling together side jobs to keep things moving, and there was not a lot of, there has not been a lot of money yet, right? We're an early stage company. And then the next 2 years, we were just out of my garage. So, it was hot, no air conditioning in the garage, going through the ups and downs of fundraising, and the ups and downs of bank account balances that move with that. And so having people who are willing to handle that stress alongside you and share that stress is super critical. But and then also to the skill set side, everybody has to be able to contribute above and beyond, right? Because you're all doing 6 different roles. Nobody's doing one role. You're overlapping, and so we've now expanded our team out. Past our co-founding team, still a small team. We've got most of our group here in Southern California, but also spread across the U.S. And our chief strategy officer, Dave Wilkinson, joined us about 1.5 years ago as somebody who has really been there and done that, scaled other medical device robotic companies from pure R&D firms up to launching their first medical device, and then also going from a slightly larger startup up through an IPO. And so he's helped us take what were initially ideas, prototypes, and dreams, and turn that into proper medical device company, quality systems, regulatory pathways that are ironed out so that we can launch. And so bringing diverse skill sets and backgrounds and knowledge onto the team is super critical when there's only so many of you. And I think I was talking with a friend about the hiring process because we just brought on an amazing mechanical engineer who brings a whole other set of previous experiences to the table. Hiring is one of those incredibly difficult things because, again, you're getting into a relationship with this person at some capacity. You're going to see them all the time. You're going to have to really trust them. And so, again, I found the most successful thing being just talking with people, right? Like we met Dave through a colleague of mine who I'd worked with before, who had met Dave's kids while windsurfing, and then they'd stayed in touch for years past that. And Dave was looking for a new opportunity in exoskeletons, and it just funneled back through, right? And it's been a wonderful fit since. So you never know where the next team member is going to come from, or when you're going to be in a place to bring on an amazing team member, right? Super early, again, back to capital. Capital is your ability to bolt people onto your team before you're out there generating revenue. And so just constantly kind of, I think, being opportunistic almost, suddenly you've got just enough money and just the right person comes along and you bring them into the team, and then you grow from there. But that's another reason why it's exciting to talk with you, Grady. I know that's your specialty, right? And so looking for additional people and growing amazing teams it's great to know people like you who are connectors in that space.
I appreciate that. And yeah, Dave's awesome. So great hire.
Yeah.
But yeah, it's true. What you said, continuing to have those conversations and things like that is important. Sometimes people, and everyone's guilty of it, whether you're a hiring manager, a founder, or even an employee, you put your blinders on, you got your head down, you're focused on whatever you're doing, and you don't want to have the conversation. You don't want to entertain anything because you're like, well, it's not the right time, or I don't, my perspective, slightly biased because I'm obviously in the recruiting world, but I also see the benefit of it is to just have the conversation, to continuously network, build those relationships, because whether you're not looking to hire or to be hired, you're always looking to grow your career and your professional network and learn about what's out there and what other people are doing. It doesn't have to be that transactional of like, I'll only talk when I want a job, or I'll only talk to someone when I want to hire them, because they may introduce you to your next board member, advisor, investor, or that candidate might introduce you to someone else who you could end up hiring. That's so valuable just from, like I said, that 20, 30-minute conversation. Easier said than done when you're very busy, but there's definitely benefit there.
Yeah, but you have to prioritize it, right?
Yeah.
Like you've got accounting needs to get done, you've got a board meeting, you've got a product launch, but you've also got to get out of the building and talk to people, right? Because you might meet somebody and then 2 years later comes around and something
for sure,
or you're able to help them 2 years later, and that's definitely what goes around comes around in times of when you're trying to build things.
Yeah, I think it's been really cool to watch how our network grow over this journey. I think we've definitely grown as a technical team, but our people skills and our network has also grown. And I think you need to have both. They're equally important.
Yeah, what Owen is saying politely is that usually you don't put the engineer as talking to people, but he's trained me enough now that I can talk with others, and so he lets me go out and have these conversations.
You've given him that media training. Good stuff.
Yeah, exactly.
That's awesome. How do you guys balance that? Because obviously it's still early days, but you're balancing innovation with, you're doing these pilots and trials and new iterations, and there's practical business side and needs that need to be hit. How do you balance that at the moment with with the team that you have and your milestones?
I think balance is a funny word.
Manage.
Yeah, yeah,
Handle.
yeah. I think that maybe those are more accurate. I mean, I think we've really adopted a pretty good internal sprint model where we set a very clear goal, usually a month to a month and a half ahead of where we want to be, and then we stack up each of those pieces you mentioned depending on how we need to get there. Like, sometimes it's just pure product, right? And so we need to get the product from where it is today. We need to add these 3 additional features because we just, we're talking with 5 doctors and they all name the same feature. So, okay, we're going to go heads down, very focused on products. And then, you have usually founders or management still poking their head up at other, still getting out, talking to people, fundraising, whatever it is, but really focus the team. So I wouldn't say that, across a 12-month span that the bar graphs of clinical versus product versus fundraising are the same month to month. It's kind of more on a sprint level. Like, what are the most important things we need to do to achieve the next 1 to month and a half goal, while still, you need to have your head up to look at your 6-month and 12-month and 18-month goals as well, right? Stay in alignment. But
yeah,
it's really just kind of comes down to what is the most important thing in that shorter sprint that keeps you on alignment towards the larger goal. And that's something, again, where we built that process internally, but bringing on some people with a bunch of experience, like our strategy officer, Dave, and we've got some really wonderful advisors now at this point, who have built companies, run clinical practices, engineering professors who have a little bit more experience at managing projects over long term, but still making really great day-to-day progress. And so, being very candid with our advisors about where we are and the challenges that we're facing has allowed us to quickly, I wouldn't say, we're certainly not always making correct decisions. Nobody is.
it is, yeah.
But getting feedback and staying, for the most part, on course, I think. Pinging these sprints off of advisors and making sure that we're in alignment with our priorities across our different groups.
Great stuff. Let's talk about the future for a moment. What are some of the current trends in the assistive technology space that excite you?
Well, I think there's really a lot of exciting things that are happening. And I think it's not really one thing. I think it's all of the things taken together. So, I think like 3D printing, for example, is something that has been around for such a long time. But, that coupled with, frankly, like AI and being able to design faster and do things faster, I think, is going to lead to a more individualized experience. For me, one of the things that's a challenge is finding really specialized technology for someone that has a very specific disability, kind of the bell curve of things that fit the average person. The outliers, the 5% on either side of the bell curve, things don't really work for. And so what's exciting to me is the ability to rapidly iterate on a lot of things to be able to make something really, really specialized. That's kind of on the hardware, software side of things, but on what we talked about earlier on the business side, I think that we're seeing a lot of advancements in how healthcare is paid for, and I think just as our problems continue to get exacerbated, I think there's going to be more of a need to continue to innovate on both the technical and the business side of things. And so I think the kind of confluence of all of that coming together is what really excites me and why I love working in this space right now.
Yeah, 100%. And I think to expand on that, one of the things I'm excited about is startups in the assistive technology space. They're growing. There's Owen mentioned this earlier, but there's been investors are now really starting to see the opportunity in age tech broadly, sort of buzzword age tech, silver tech. AARP is now a huge startup investor. Yeah, and you never would have
thought. CES, their space at CES, blows my mind. Last couple
it's
of
huge,
years,
yeah. And so we're close now with quite a few startups that are in their ecosystem, and solving the elderly home care and just broadly elderly and aging population problem directly parallels with traditional assistive technology issues, right? As people start to lose physical function, a lot of the needs and devices can support elderly, can also support chronically disabled, and so we're seeing a lot more investment going into this space because of that. The TAM is now growing, and again, you don't want there to have to be a large TAM for something to get made, but unfortunately, that's just how venture capital works, right? And so you just look at it from their side, and so it's just exciting to see that now there is a lot of venture flowing into the space, and so there really is a lot of opportunity to help people broadly. And so you're seeing all types of there's a really amazing startup out of CES, another Berkeley spin out, Augmental. It's got a retainer that basically turns the top of your mouth into a trackpad. That there's just
that's amazing.
That could be used broadly for wheelchair control, assistive device control, but also for anybody. And so I think you're seeing huge growth in assistive technology investment. And as a founder in the space, that's super exciting. And it's being done for, I think, good reason. So
exciting, very exciting.
Yeah.
What role do you see AI playing in or if any, in the space?
I can speak, just quickly to our product directly, and then maybe Owen can talk a little more broadly. But so, our device is effectively a telehealth-enabled knee brace. We've got a motor attached to the joint, so we can provide assistive or resistive forces to the body. And AI, our device, we already do calibration steps. The device understands where the patient is day to day. Artificial intelligence and machine learning will really level up our ability to make the patient feel like the device understands them. We think about our device as an extension of the physical therapist's hands. When a patient goes in to see the PT, and the PT is working their joints and their muscles and everything, it can be hard to do rehab, but they know the PT is trained, they trust the PT, they're there for their knowledge. And so I think that AI and machine learning will really allow us to bring that feeling of trust between the patient and the PT into the space between the patient and the device. The device will really understand where the patient is and where they need to be going, and that's going to help patients recover faster, because with the trust the device is only pushing them as hard as a PT would, then they're willing to lean into it, right, instead of sort of being nervous about the system. So I think that's an immediate benefit that we will see directly with what we're doing. But I think obviously AI is going to impact the space super broadly, and it already is.
That is exciting.
Yeah, not too much more to add on that, but I think that one specific thing is that speech recognition. Some of the AI speech recognitions have a much easier time understanding me, and I think also for people with developmental disabilities, I think AI will have a really profound impact on that as well, and being able to kind of navigate social situations as well. So I think the effects are going to be really, really far-reaching.
That's great. Yeah, when you look at it through that lens, it's there's so much positive. The press sometimes there's people that look at AI like it could be all bad and doom and gloom, but when you look at it there's obviously good and bad to everything, but there's so much positive that can come from it, especially in these applications.
Yeah,
definitely.
From the healthcare benefits side, absolutely. And also back to the investing side, it's making it like measurably cheaper to start and run a business. And so in a space that's been traditionally difficult to get venture capital into, you could now, raise from a group of angels a small seed round into a hardware company, and then go be really effective bringing that product closer to market versus needing to go raise, tens, $20 million. So I think AI is just going to be a catalyst to getting more deep tech, hard tech companies funded, because the cost will come down. I mean, you're seeing cost in software drop to like zero, which is nuts. It's almost too far where investors can't put enough money to work, right? But in hardware, there's still plenty of money to be put to work, but it's now coming down to where, it's getting more and more viable.
Yeah. I think the other thing is kind of on our specific side is that our device, our hardware is positioned to be able to collect a lot of data that otherwise isn't collectible in the healthcare space. So particularly around, physical therapy and recovery. And so kind of an additional moat that we have is the data that we're collecting that can then be used to, train additional, algorithms on how to perform better physical therapy. So I think that's another really exciting part about being a hardware company during the AI craze is that we're positioned to collect data that isn't otherwise available.
That's really interesting. Yeah, huge benefit. So, what in terms of short-term plans and long-term goals for ATDev? Is there other things that you can share with us right now?
Yeah, absolutely. So on the short-term side, we will be launching our Reflex product later this year. Very excited, to be moving from the studies side to actual real-world product.
That's great.
Yeah, so we'll be out in clinics across the U.S. later this year. And then long-term with the sort of growing the Reflex product, right now we're focused on the knee, but we want to expand to other joints, also move out of orthopedics into the neurospace, stroke recovery, spinal cord injury. These types of technologies are very broadly applicable to patient physical rehabilitation and in the clinic, but then also a ton of potential support for rural patients who struggle to get to clinics, right? We can get hands-on care. And so we long-term, we envision this ecosystem of devices that enable people to live independent no matter their level of physical ability. So that looks like exoskeletons, wheelchairs, but also periphery devices, smart homes, autonomous travel. So, we're not saying we're going to build all of those things, but we want to facilitate the creation of that ecosystem. And we're really focused on the personal devices that can then communicate with the rest of it. But that's where we want to go. Live in this world where through technology, you can stay independent no matter your level of physical ability.
That's amazing.
Yeah.
Good stuff. Well, look, I was going to ask you how you guys are going to look at making a difference in the lives of people in the next 5 years, but it seems like you're ticking all of those boxes there with what your plans are. So I'm loving hearing all of this. It's very exciting, and I'm really glad that I can have you guys on the show and have you share all of this stuff with us. So thank you. Before we go, You've shared a bunch of really great advice and your own stories here about being an entrepreneur and everything like that. But is there anything that you can, off the top of your head, share with aspiring entrepreneurs in the tech space or robotic space, assistive technology space?
I think I'm just going to double down on just get out there and talk to people, right? Like if you have an idea, start talking to your friends, talk to your family, then, talk to enough people that somebody will say, hey, I know somebody who has a job in that space or who knows somebody who has a job in that space. And then you talk to them and then you get some real feedback. And then you just keep talking to people and be willing to take in their feedback, learn from it, and then kind of you have to be true to your vision and your mission, right? Ultimately, because it's going to come back to you and your founding team as to what it is you want to do and what gets you up out of bed. But just get out there and listen to what people are telling you and let that advise how you want to grow. And then also apply for grants. 100% it's a lot of time, it's a lot of energy, but there are tons of resources, both federally and state in terms of money. The SBIR program is amazing for robotics. The NSF, the NIH, if you're in the medical space, they want to give out these $300,000 to $2 million grants to grow small businesses. And they they have resources on how to write them. Like you can go to free webinars that will teach you, just type in SBIR webinar, or go to our website and contact us. We'll point you towards stuff, but apply for grants, because not only is it non-dilutive capital, so they're not taking any interest in your company. It's also for super early stage and even later stage investors, it's a huge diligence check, because that means that a group of PhDs, at NIH, NSF have looked at your tech ideas and have said, okay, yeah, this is new, this could work, it's exciting. So it's been a huge part of our diligence process and sort of vetting process, because investors are not going to be always an expert in what you're doing, and they're not going to have time to learn everything about it. But if they can say, hey, they've already raised a couple $100,000 or $1 million from grants because the technology is viable, great, okay, we can check the tech, now let's just look at the market. So
I didn't know
those
that.
would be,
yeah, that's really cool.
Yeah, I mean, not every investor will look at it that way, but that has been our experience.
But I mean, even for the SBIRs, I didn't realize that that's their diligence process. That's a awesome data point when you are looking to raise capital as well, that you've already had eyes on it from this group of people.
I've now been on the reviewer side now. I've been tapped a couple times to review NSF grants, and it's 15 plus people that are in a group. Usually you have 4 to 5 people who read it diligently. They're redlining it, going through everything, and then you meet with the group of 15 and discuss it. And so you've read your set that you read very diligently, and then the other ones, if you haven't read one, will be presented to you, and then you all sit there and vote, discuss. It gets very nuanced. People will dig in and say, hey, I don't know if it's going to work if they write their algorithm this way, or maybe this partner could have been better. So it's a lot of back and forth to then green light. Grant funding success is roughly 10 to 15%. So if you can land one, and you will, you just keep working at it. You'll if you're really motivated to do it, you'll land a grant. And again, there's resources to do it, and then it's the benefits are tenfold.
So, Owen, was there anything that you wanted to add to that just before I?
Oh no, that's good.
Yeah, that's really. I mean, honestly, the advice that you guys have given and the journey that you guys have had, especially in the early days, and seeing the benefits of that is enough advice and enough positive direction for anyone who's interested in this, that I think they'll get from this episode, and drill down. Speak to your customers, speak to the user base, build something people want. Even if you can't go through one of the programs like you guys went through, I'm sure there's ways that things you can take out from there. Speak to as many customers, as many people as are willing to take your call, just to gather that data, gather that insights, and don't build in a vacuum. We've heard it time and time again on this show. Don't build in a vacuum. Don't build it with your head in the sand. Get out there in the real world.
Yeah.
Awesome. Okay, so before we wrap, guys, where can listeners find out more about you guys, support ATDev, your mission? Obviously, you're growing, so keep an eye on all of that stuff and follow you guys individually.
Yeah, so LinkedIn for sure. We're both on LinkedIn. If you just search our names, Todd Roberts and Owen Kent, and then ATDev. Also, assistivetech.dev is our website. We've got a contact us page. I get all those emails get forwarded directly to me. So if you ping us there, just drop us a note. And if you're interested in learning more, partnering, building, whatever it is, feel free to contact us through that little message box.
Amazing. Well, look, I'm looking forward to keeping an eye on everything you guys do this next year, hopefully supporting you and helping you. And I'm excited for people to hear this episode as well. So thank you again. I really enjoyed it.
Yeah, thank you so much, Greg.
You, Greg. This is great.
Yeah, my pleasure. All right, I'll speak to you guys soon.
All right,
good.
take care.